Good afternoon, and thank you for joining the ONC Health IT Certification Program Developer Roundtable. My name is Kim Paletti with Audacious Inquiry, and our team will provide technical assistance for today's session. If you need any technical support, please type your issue into the Q&A box, and one of our team members will assist you. Please be aware that today's session will be recorded. Closed captioning is also available by clicking on the CC icon at the bottom of the screen. Any questions you may have during the presentation can be placed in the Q&A box and will be addressed either in writing during the presentation or verbally at the end of the presentation if time permits. Today's discussion will be led by Jeff Smith with ASTP's Certification and Testing Division. So to get things started, I'll turn it over to Jeff.
All right, thank you, Kim, and welcome everyone to the third and final roundtable of the year. If you go to the next slide, we'll talk to the agenda. So we've got a couple of deep dives that we're going to take here, primarily focused on conformance with the certification program's standardized API for patient and population services requirements and associated conditions and maintenance of certification requirements. We also will highlight a few end-of-year deadlines to be cognizant of. But before that, we need to do kind of the obligatory disclaimer. So if you can go to the next slide. The materials contained herein are presented based on provisions in 45 CFR Part 170 and 171. While every effort has been made to ensure the accuracy of these restatements of those provisions, this presentation is not a legal document. The official program requirements are contained in the relevant laws and regulations, so please note that other federal, state, and local laws may also apply. This communication is produced and disseminated at U.S. taxpayer expense. All right, next slide. Okay, so hopefully this is not news to most of you. But by December 31st, 2024, there are some HTI-1 related requirements, notably developers with Health IT certified to the clinical decision support certification criterion that's currently adopted at 45 CFR 170.315A9 must update their certificates for the decision support intervention certification criterion at 315B11 and provide such certified health IT to their customers. Now, this is, of course, if you, as a developer that have currently certified technology to A9 want to continue to meet the base EHR definition. That's where the timing requirements are for the certification criterion. In addition, developers with Health IT modules certified to G10 must publish their customers' service-based URL information according to specific adopted standards that are referenced in 45 CFR 170.404B2. I will note that we earlier this year put out a clarification that indicated that developers have the flexibility to continue or to consider using the organization and endpoint FHIR resource profiles, such as the profiles in the user access brands and endpoint specification or validated healthcare directory implementation guides to meet that requirement. So we did want to make sure and highlight that flexibility for all of you. Okay, next slide, please. Okay, just spending just a little bit more time on the B11 requirement. For those of you who have been following along, we've put out a number of resources and have done a number of webinars where we've really highlighted the obligation for developers to indicate whether they do or do not supply predictive DSI by going through and really understanding the definition. ONC is not making that determination on behalf of the developers, but it's certified health IT developers with modules certified to B11. It's your obligation to make that determination for yourself. And essentially, we've got a three-part definition for the technology that would be under the scope of our requirements. And this includes both generative and predictive AI that support decision-making. We have a number of clarifications too that come directly from the HTI-1 final rule regarding supplied DSIs. It's only those supplied DSIs that are subject to ONC requirements. So some of you may have technology that meets the definition of predictive DSI, but you may not actually supply that as part of your B11 certified module. And we've got a number of clarifications here in terms of how ONC interprets supplied by. These include interventions that are authored or developed by the developer of certified health IT, as well as those technologies that are authored or developed by other parties that the health IT developer includes as part of its health IT module, such as, quote, when entities have contracts specifically covering the enablement and use of such technologies. This concept of supplied by also means that the certified health IT developer has taken on stewardship and accountability for the predictive DSI for the purposes of their health IT module. We interpret as part of its health IT module to mean that the certified health IT developer has explicitly offered or provided its customers the technical capability to use or support a predictive DSI. And then importantly, we say that as part of its health IT module includes any supplied DSI that are part of a B11 certified Chapel listed product. This means that if a developer supplies a predictive DSI as part of its product that is B11 certified, the developer must include source attributes and meet other requirements for that predictive DSI, such as risk management, according to the final regulation. Okay, next slide, please. Okay, this is the last piece before we dive into the API stuff. Really important to note that we issued a clarification last month. And essentially what this does is it provides developers flexibility as it relates to source attributes. So we understand that health IT developers may not have access to complete source attribute information for all DSIs they supply, especially for DSIs developed and deployed many years ago. In cases like this and others where source attribute information is not available, a health IT module certified to B11 should clearly indicate unknown when a source attribute listed is not available for the user to review. While we understand that in some cases the source attributes may not be available, we note that we expect health IT developers to exercise due diligence before making a determination that a source attributes information is unknown. We also note that developers of certified health IT that have modules certified to B11 are required under the assurances and maintenance of certification requirement at 170402B4 that starting January 1st, 2025, and on an ongoing basis thereafter, developers need to review and update as necessary source attribute information. Where source attribute information later becomes known, developers would be expected to make such information available to their end users. And then we provide a hyperlink to that section of the final rule, HTI-1 final rule, and a link to all of the other clarifications that we've provided on the ONC certification program website. And I will note here that these slides will be available after this presentation, along with the recording. Okay, next slide. Okay, I'm going to hand things over to Keith Carlson to take it from here. And just a reminder to go ahead and put questions into the Q&A box, and we'll do our best to answer those in real time. And if we have time at the end of this presentation, we will try and answer those verbally.
Thanks, Jeff. Hi, everyone. This is Keith Carlson, also in the Certification and Testing Division, and I'm going to kick us off for the remainder of this roundtable. We're going to be talking about, API-related feedback we've gotten and kind of going over some of the related program requirements. And so the grounding for all of this, or kind of the basis for why we're talking about this today, it's all outlined in a recent blog that was put out by our Assistant Secretary and National Coordinator, Mickey Tripathi. Would encourage folks to go look at it if they haven't seen it already. Mickey kind of goes over some feedback we've heard from API users, for example, third-party app developers that are, developing apps to connect with certified API technology. And, it's ASTP's priority to ensure that certified API developers conform to program requirements for certified API technology. So we're here to kind of talk about some of this, talk more specifically about the things Mickey was touching on in that blog, and just kind of have a, discussion and go over, the requirements again, as, and also you can look forward following this to more resources, communications, webinars, like this roundtable is part of all of this effort, moving forward to kind of talk about this stuff and keep hopefully educating people and discussing these requirements. So we can go to the next slide. All of these things, this is part one, and there's going to be one more slide here. This is just going into the more specific things that I'm about to talk about for the next few slides. All of these are going to come up again, so I won't, spend a lot of time on these right now. This is just more detail into some of the higher level, things that was identified in that blog. We're going to talk about some API documentation things, app registration things. We can go to the next slide. Also go into some feedback we've heard of, issues with responding to API access requests, and then touch on some app developer and patient experience related things. So we can jump right into it in the next slide. Yeah, so getting specific here with some issues and talking about some program requirements. This is related to accessing API documentation and service-based URLs. And again, service-based URL is the technical term for the FHIR endpoints. This screenshot on the left shows an example of a G10 certified listing on the Chapel, the certified health IT product list. Hopefully a lot of folks already recognize this. Just want to get real specific about the links and the information that we're talking to here. Each G10 certified health IT module will have these two links to the documentation and service-based URL list that is made publicly available. This is critical information that any third-party app developer is going to need in order to integrate with a G10 certified API. So we've been hearing a lot of we've heard, about some issues in some cases with some of these modules and some of these, or some of the links provided in these certification listings on the Chapel, specific things like the links just being unresolvable and, not being broken links. Essentially, we've heard about both the API documentation and the service-based URL lists. In some cases, linking to not directly to that information, but may, for example, link to the certified API developer's homepage, which, it would require more effort for someone to have to navigate that homepage, versus just having direct access to that information. You feel free to interrupt me, Jeff. I saw you come off mute, but if we're good. And then we also saw, some issues with like just the service-based URL list not being complete, not containing all the patient access API endpoints necessary. And I've also heard a lot about the challenges with organization details not being published alongside service-based URLs. It can make it hard to contextualize what that service-based URL refers to if it doesn't have kind of additional information around it. So zooming into the actual applicable program requirements that we want to just emphasize related to some of these things we've kind of heard about. Certified API developers are expected, it is a certification requirement, and you can find these in 170315 G10 and 170404 that it's expected that this API documentation links are kept up to date and that the service-based URL lists are kept up to date. These things can change, especially the service-based URL lists with customers that change, and it is expected to maintain certification that this information is kept up to date. And then in terms of the organization details with service-based URLs, something that's not required as a baseline as of right now, but per HTI1 requirements that will become the baseline in just a couple months at the end of this year. We're Jeff already mentioned it before, finalizing a requirement for publishing service-based URLs and organization details in FHIR bundle format. You can see go look at the specific regulation text for more information there. We can go to the next slide. For some more issues this time, talking and this is going to kind of be a whirlwind of like going into these issues. This is still on the topic of API technical documentation things. So even if maybe the links are resolvable and linked to a direct place, we have heard feedback from third-party app developers that they are finding that in some cases, there is not enough public information to actually support the registration process in the documentation. And then we've heard about there's, challenges with getting in contact with developers if there's any issues, no ability to provide feedback to developers. In some cases, no ability to provide, feedback on this technical documentation. And again, just reiterating that in some cases, it's just, we've heard about documentation being obviously not kept up to date. So just emphasizing what the program requirements are related to some of these things that, is important folks, certified API developers keep in mind. It is again expected in both 404 and G10 touch on requirements for publishing and keeping up to date complete business and technical documentation. And, in the regulatory text, you can see some more specifics around there. It's summarized here that this technical documentation would include all information needed to register an app in a production environment. It also needs to include terms of use and registration process requirements. So just, very important information that needs to be published and kept up to date. We can go to the next slide. Related kind of, some API registration specific challenges, kind of moving out of the documentation realm a little bit to some of the registration things we've heard about. We've heard some instances where third-party app developers have informed us that in some cases they're being required to obtain individual registration and approval for each health system or provider organization. So having to go to a provider's organization to get them to allow their app to connect. We've heard about third-party app developers being required to complete separate manual questionnaires for each FHIR endpoint they want to integrate with. So if a developer has many different endpoints for all their customers, in some cases, these third-party app developers have faced needing to fill out a questionnaire for each one. And, both these things go into registration not being completed in a timely manner. Also in other just general situations, we've heard a lot about cases where registration is not being completed in a timely manner. And so there's some pretty specific program requirements on this. We'll see in the second half of the slide here is an API maintenance of certification requirement. So to maintain for certified API developers to maintain their certification status, it is expected that they register apps for production use with their G10 certified health IT module. And we set specific timelines for these registration requests to be processed. So there is a optional, certified API developers can optionally institute a authenticity verification process. This needs to be an objective process that is the same for all API users. But if there is an authenticity verification process in place, it can take up to 10 business days to complete, no longer, to meet our requirements. It can be no longer than 10 business days. And then upon completion of authenticity verification, final registration for production use must be completed within 5 business days. And I will certainly also note, if it's not already clear, that if there is no authenticity verification process, then it's really just that within 5 business days of receiving a request, it is expected to as a maintenance of certification requirement in our program, that registration for production use needs to be completed. So let's go to the next slide, please. More registration related things that we've heard about, these are kind of some non-standard workflows that some of the API users have been directed through, and some kind of extra burdens overall. So we've heard about implementers requiring, in some cases, patients to authorize, a patient to have to authorize an app through a non-standard practice. For example, having to go through their, patients are being, you've heard about cases where patients using an app of their choice are being directed to the healthcare provider or provider organization to authorize that app to connect with their medical record. And we've heard about, some cases where patients are being told that they need to create separate logins. Again, when they download an app to authorize, told, instead of being a common flow would be to redirect or direct that patient through their patient portal to authorize. And in some cases, we've heard about kind of separate logins. And so, some of the program requirements that just we want certified API developers to keep in mind related to things like this, as a blanket general API condition of certification requirement. You know, this is at the top of, I think it's the first paragraph of 170.404. You know, we require that state that certified API developers, from their perspective and in control of their technology, are expected to publish APIs and allow electronic health information from such technology to be accessed, exchanged, and used without special effort. That last phrase there, without special effort, is kind of just the key thing I want to re-highlight here. That's, you know, without special effort is a statutory authority, you know, ONC's following in developing these requirements. And it's also something that just is something to be mindful when, you know, fostering or deploying these APIs and making sure they're accessible in a certified API developer's deployed product. And then there are just some specific technical things, you know, that just wanted to highlight related to this, just to make clear that any G10 certified health IT module that is deployed to a certified API developer's customer, if they went through certification, then they went through a process of demonstrating application registration with their health IT modules authorization server. You know, this doesn't include any kind of other healthcare provider being looped in. You know, application registration will be demonstrated without some of those extra things that some of the issues we've heard. And then also, you know, the module must support standardized authentication and authorization, you know, an industry FHIR standard, SMART app launch framework during the process of granting access to patient data. So, you know, these are things that will be available in the deployed product, and just, you know, important to remember and make sure that the module is following for certification. So we'll go to the next slide. And these, again, there's so many things related to app registration. You know, this is kind of another things related to HIPAA business associate agreements that we've heard about in some cases, where some third-party app developers have said they have been required to you know, I'll zoom in on that example situation in the middle there. You know, we've heard about instances where certified API developers require an app developer to sign a HIPAA business associate agreement before agreeing to register their app for patient access for production use. And there's very clear program guidance and requirements around this. You know, you'll see language on this in the Cures Act final rule. Certified API developers shall not require HIPAA business associate agreements, nor business partnerships, nor agreements as a prerequisite for app registration for patient access. That patient access thing is key to EHI via certified API technology. I'll highlight that, you know, because I know in some cases business associates agreements might come into play when we think about some of our, because we also in G10 have a requirement for a multi-patient API, you know, based on the bulk FHIR standard. Certainly it's in cases where data is being exchanged for cohorts of patients, there will be business associate agreements like this in place. But for the patient access use case, for the use case of a patient wanting to connect and on their own volition authorize an app of their choice to connect to their data, it is very important to keep in mind that for that single patient access use case, we are very clear that these types of agreements shall not be required, you know, when a patient is able to authorize access to their own data. So we can go to the next slide. Yeah, now shifting a little bit outside of the going in a little bit of a different category of issues here. This is related to, you know, we talk about what we call value-added services in our regulation text. And the specific issue here, these two bullets in the issue part are connected to each other. You know, so the specific context for kind of this issue is it's come up in the case of consumer education. Specifically, you can think about this coming up during the OAuth authorization flow, right? Smart app launch is based on OAuth. So there's a flow where the patient will be, if they're using an app of their choice to connect to their medical record, they will be presented an authorization screen to select or deselect scopes and, you know, approve or deny that app. We've heard about in some cases, these warning messages have been kind of on these authorization screens have been rather intimidating. And specifically in terms of value-added services, we've heard some feedback that third-party app developers are told that they can pay a fee to become a known app and have these warning messages removed for their users. Some of the program requirements that we just want to highlight in a case like this is that, yes, you know, value-added services related to certified API technology is explicitly allowed in the regulation text, including, you know, charging a fee for a reasonable profit margin. But It's important that any of these services that are charged for cannot be required for the efficient and effective deployment of production-ready software that interacts with certified API technology. You know, and just highlighting that we have many paragraphs in our, or, you know, a bunch of paragraphs in our regulation text at 1704 for related to fees, and make clear, you know, in those paragraphs, we make clear exactly what can be charged for. And just since I'm talking about fees, just highlighting in that last bullet that anything not expressly permitted in 404A3 is prohibited from being imposed by a certified API developer. So really things to keep in mind for any time you charge a fee and anything that's considered value-added services. It can't be in the way of efficient and effective deployment of production-ready software. We can go to the next slide. This is also related to that same consumer education type thing. I talked about how on the authorization screen, you know, we've heard about cases where, you know, there can be some, maybe in some cases, possibly intimidating information. There's also an information blocking view to just be mindful of when presenting education information to patients like this. Again, the example situation is that, you know, we've heard about certified health IT displaying a notification to the patient as part of the app authorization about whether the app developer's privacy policy and practices meet best practices set by the market. And while this is not saying that this is prohibited and that this is something that's, you know, providing information like this is not something that's prohibited, there are some important info blocking related things that need to be kept in mind. You know, any education needs to focus on any current privacy and or security risks posed by the app. And it just needs to be something that's factually accurate, unbiased, objective, and not unfair or deceptive. And it needs to be communicated in a non-discriminatory, any of this information needs to be communicated in a non-discriminatory manner. We can go to the next slide. And then these last two slides I'm going to go into before passing it off is just, they don't have tie-ins to direct program requirements, but just in the spirit of kind of fostering what we hear from developers and hopefully, you know, everyone working together to kind of support the patient access use case. Just want to make these things clear as some kind of low-hanging fruit things if folks have not already, you know, kind of been aware of these things. We've heard feedback that in some cases the app authorization screens lack some obvious ease of use features. For example, again, when the patients are presented an authorization screen with a list of scopes to select or deselect, in some cases they don't have simple like select all or deselect all buttons, which they're simple things that could make the user experience process for a patient better if they want to select or deselect all. So just we want to make the note it's something to consider. We encourage folks to consider these user experience type things, you know, especially things like select all and deselect all when appropriate for selecting or deselecting all of these scopes for authorization. We can go to the next slide. Similarly, from you know, that was a patient experience enhancement to consider. This is an enhancement for third-party app developers that we've heard a lot about that they say is really important and really necessary, but doesn't have an exact tie into certification requirements. You know, this is related to sandbox. We've heard about third-party app developers not always being able to find sandboxes to use to test their apps with, to test the integration before deploying to a production environment. And like, certainly want to emphasize that our conditions and maintenance and certification requirements at 404 require that certified API developers need to provide all necessary support for the app to, you know, for an app to be able to connect and be used for production use. We encourage this to include also sandboxes. You know, they're not specifically mentioned in regulation, but would certainly include or encourage supporting third-party app developers being able to test with your certified API technology before deploying it into a production environment. So that was a whirlwind of stuff. Appreciate people bearing with. I'll go to the next slide and be passing it off to Scott.
All right, thank you, Keith. This is Scott Bohan from the ASTP ONC Certification and Testing Division, and I'll be covering a brief review of some of the technical requirements from the G10 Standardized API for Patient and Population Services Certification Criterion. We can go to the next slide. So the G10 criterion defines requirements for a single patient API and a multi-patient API according to the FHIR standard and many FHIR implementation guides, as well as other reference standards. And this slide shows a high-level summary of some of the requirements from the G10 implementation guides referenced in the criterion. And as you'll see here, the G10 criterion requirements cover subjects such as app registration, security and authorization, search and data response requirements, and documentation. Next slide, please. But just highlighting that for this review, we will be focusing on the app registration and documentation requirements from the G10 criterion. And these requirements were the focus of many points of feedback we received, as noted earlier in the presentation. Next slide, please. Okay, so starting with the app registration requirement, this is the requirement where the Health IT module certified to the G10 criterion must enable an application to register with the Health IT module's authorization server. And support for this requirement is important since app registration is one of the first steps needed for an app to use certified API technology certified to the G10 criterion. And while the criterion does not specify a standard for the registration requirement, there are minimum requirements that must be met. And these requirements include demonstration of the app registration capability for certification testing, demonstration of the app registration process in publicly published API documentation, and the treatment of the app developer affirmations used for registration in a good faith manner. Additionally, as per the API maintenance of certification requirements, certified API developers may implement an optional API user authenticity verification process. So overall, I will reiterate that it is important for certified API developers to fulfill both the technical and documentation requirements for registration. Next slide, please. All right, so moving on to program requirements for G10 criterion for API documentation. So the G10 criterion specifically requires that API documentation be provided at the time of certification and subsequently kept up to date. And this documentation must include information about both the single patient and multiple patient APIs that are part of the G10 criterion. And complete up-to-date documentation is important to enable API users to understand and use the certified API technology. And so the program requirements for API documentation for the G10 criterion include specific technical details. These are things like API syntax, function names, return variables, exceptions, and exception handling methods, software components and configurations necessary for an app to successfully interact with the API, and registration requirements and attributes necessary for an app to be registered with the Health IT module's authorization server. And again, reiterating this point around app registration, that including the registration process in the API documentation is important to inform API users how to register their application with the certified API technology. Also noting again that this API documentation must be kept up to date, and a publicly accessible hyperlink to this documentation made available in the Certified Health IT product list, also referred to as Chapel. And so that concludes our brief review of G10 criterion requirements. I'll pass it over to Johnny on the next slide for API condition and maintenance of certification requirements.
Great. Thank you, Scott. I'm also a part of the ASTP ONC certification division, Johnny Bender. We can go to the next slide. What we're going to do while we're going through this, I pasted a link in the chat to the ECFR if you want to read the actual reg text for the API condition and maintenance of certification requirements. This is a refresher. I'm sure most are familiar with these requirements, but just thought we would go through this here. So the API condition and maintenance of certification requirements address the technical and business practices of certified API developers for health IT modules that are certified to any of the criteria from G7 through G10. I thought we would start with some definitions. We defined terms that we use throughout the condition and maintenance of certification requirements in 17404 C. And these are certified API technology, certified API developer, API information source, and API user. Certified API technology being technology that is certified health IT modules that are certified from G7 through G10, certified API technology. Certified API developers are any health IT developers that create certified API technology. API information sources are organizations that deploy the certified API technology in production. So these are like healthcare organizations like ambulatory or hospital systems. And then API users are persons or entities that create or use software applications that interact with the certified API technology. So importantly here, these API users could be third-party app developers or could be patients that are using apps to, for example, access their health information. We can go to the next slide. So starting just with an overview of the API condition of certification requirements. So if you look at the reg text, we have several different sections. We start with a general section, which just outlines that certified API developers must publish APIs and allow this electronic health information from this technology to be accessed, exchanged, and used without special effort through these APIs, including providing access to all data elements of a patient's electronic health record to the extent permissible. So this without special effort phrase comes from the Cures Act and was finalized as part of the Cures Act final rule. And so that's just a general provision. And then we go into some specific conditions, including transparency, fees, and openness and pro-competitive conditions. Transparency being related to business and technical documentation and some terms and conditions, really just trying to outline sort of in a transparent way the terms around the use of technology, certified API technology. The fees section are the permitted and provisions around the prohibited fees for certified API developers. And then openness and pro-competitive conditions are just requirements for non-discrimination and access of use of health IT, and then also service and support obligations there too. So we can go to the next slide and we'll dive into some of the details. So for the transparency condition, is at 17404 A2, health IT developers are required to publish complete business and technical documentation that is necessary to interact with the certified API technology. This also includes anything that's needed to distribute, deploy, or enable the use of this technology, and verify the authenticity of users and register software applications. Importantly, and then also health IT certified API developers are required to publish any and all fees that are charged by a certified API developer for the use of its certified API technology. And then all of the documentation must be accessible via a public accessible document or hyperlink that allows any person with knowledge to access it without preconditions or additional steps. I'm going to the next slide. And this is for the fees condition. And so we, in this section, we outline categories of permitted fees that certified API developers can charge, and when these can be charged. These are fees for the development, deployment, and upgrade of the API technology, fees for recovering API usage costs, and then fees for value-added services, as long as these value-added services are not necessary to efficiently and effectively develop and deploy production-ready software. We also outline in this section that all fees that are not explicitly permitted are prohibited. And these are fees obviously related to the certified API technology that is in scope in these condition sections. We can go to the next slide. Great. And then we have the openness and pro-competitive conditions. So in this section, we try and promote an open and competitive marketplace. And so we include concepts around non-discrimination, rights to access and use the certified API technology. So non-discrimination being that you can't discriminate between, for example, like API users that want to use the certified API technology, based on criteria that are not objective. So the criteria must be uniformly applied to all substantially similar or similarly situated classes of persons or requests. And then rights to access and use certified API technology. Include things like accessing and using this technology in a production environment, develop these products and services using the technology, and then market or offer or distribute these products or services associated with the certified API technology. So you cannot restrict the rights around these items. And then we also outlined some prohibited conduct regarding the rights, including fees like license fees, royalties, etc. And then we go into, there are just several examples of prohibited content that we or conduct that we don't have time to dive into today. And then finally, in this section, we have service and support obligations that certified API developers need to provide in order for the end users and customers to just be aware of any changes or updates being made to the certified API technology, or if there are any changes or updates to terms and conditions. Go to the next slide, where we'll talk about the maintenance of certification requirements. And so we've included, there are more maintenance of certification requirements that are written in the reg text, as you'll see at that CFR link, but we've just included the ones that we think are relevant for the discussion today. So these include authenticity verification, application registration, and then service-based URL publication. I know we've spoken to these throughout this presentation, but wanted to cover here that for authenticity verification, certified API developer is permitted to institute a process to verify the authenticity of API users, so that it's so long as the process is objective and the same for all the API users and is completed within 10 business days. Application registration. So for this requirement, certified API developer must register and enable all applications for production use within 5 business days of completing its verification of an API user's authenticity. And then service-based URL publication requirement. So all certified API developers are required to publish service-based URLs for all of its customers for the certified API technology that can be used by patients to access their electronic health information. And this is whether or not the certified API technology is centrally managed by the certified API developer or locally deployed by API information sources. We can go to the next slide. Just wanted to go into a little more detail about our current and our current service-based URL publication requirements. Keith spoke to some of these earlier, so in the Cures Act final rule, we required this maintenance and certification requirement that certified API developers must publish service-based URLs for their customers. We were pretty vague about the format. We basically just said the publication format was had to be machine readable. And in the HTI1 update, we have moved toward some standardization here. We require that the service-based URL must be published in a FHIR endpoint resource format, and that the organization details, including some required fields for each service-based URL, must be published in the FHIR organization resource format. And then that these endpoint and organization resources must be collected in a FHIR bundle for publication. And the compliance date for the HTI1 update requirements for service-based URL publication is December 31st, 2024. The benefit of having these in a standardized format, and the reason we pursued this update, was having these accessible and in a standardized format will allow app developers to easily fetch this information to enable patients to access and exchange and use health information. I'm going to the next slide. Just wanted to cover some of these items. So we have these compliance notes. So for the condition and maintenance of certification requirements, we've gotten concerns that certified API developers may potentially be out of compliance with the condition and maintenance of certification requirements and information blocking requirements. And so we just wanted to describe some of the impacts for non-compliance. So if you are not compliant with the condition and maintenance of certification requirements, it can reduce trust in health IT. So reduce confidence in your technology and service offering, can affect technology adoption. Which could slow innovation and impact your product's success, can increase costs and inefficiency in an already pretty inefficient healthcare system. Drive up costs. Developers spend more time addressing these compliance gaps, and patient outcomes. So these can cause non-compliance with condition and maintenance and certification requirements can cause delays in data access, which can directly affect patient care, especially for those relying on timely, accurate data. Emphasis here is that compliance is not just a box to check at the beginning of your journey with the certification program. It's foundational to the success of your product's efficiency of the healthcare system and the care that patients receive. Go to the next slide. Speak to a similar topic for information blocking. Failing to meet some of these condition and maintenance of certification requirements may implicate information blocking. Certified API developers, as you all know, are subject to these information blocking regulations. And if they are engaging in information blocking, and if they knowingly or should reasonably know that their actions or inactions are likely to interfere with the access, exchange, or use of EHI, they may be, subject to the information blocking penalties. So we are working with the HHS Office of Inspector General and CMS to ensure the execution of information blocking investigations. And so the OIG is ready to investigate potential cases of information blocking. And a reminder, if a Health IT developer, health information network, or exchange is found guilty, they can face fines up to $1 million per violation. And for healthcare providers, the OIG refers cases to CMS, which applies the appropriate penalties based on the provider's actions. You can go to the next slide. And then finally, a note about surveillance and enforcement here. So we are committed to maintaining the integrity, effectiveness of the certification program, not only for our program, but also for the points that we made earlier, and then also our partnering organizations. And through ongoing oversight, we will ensure compliance with requirements in the certification program, including the aforementioned API and information blocking requirements. And when necessary, we may seek enforcement through direct review of certified health IT and the developers, and it may lead to suspension or termination of certifications. And additionally, particularly serious nonconformities may also result in a developer being banned from the certification program. We can go to the next slide. So now that we've covered all of that, we'll go through some of our next steps and some upcoming educational resources. So to support this emphasis on the compliance with certification program requirements, we are working on some improvements and educational resources to help. So one, we have implemented some improved feedback channels. So we have a new dedicated section in the Health IT feedback and inquiry portal for API related complaints and inquiries, which you can find at a hyperlink that we will post here. And we're also publishing a few resources to help navigate some of the requirements in the certification program. So one is a do's and don'ts of certified API technology and developers. So this is for sort of a scenario-based document that shows a good and bad practices to help maintain compliance with the program requirements. And I think Greg had asked a question about consumer warning messages about apps that are unknown to the certified developer. We'll make sure to address this. You asked for some specific examples of acceptable versus unacceptable practices. We'll be sure to address this in this do's and don'ts document. Feel free to offer any other suggestions for these in the Health IT feedback and inquiry portal. We will be sure to take any suggestions from the public. And then additionally, we have the API conditions and maintenance of certification fact sheet, where we will summarize certified API developer obligations for the condition and maintenance of certification requirements. And then the API documentation resource checklist, where we will describe guidance and expectations for certified API developer documentation. So we're going to try and make it easy to show kind of what an ideal comprehensive API developer documentation would look like to meet the certification requirements. We can go to the next slide. And so we will conclude here. We have 6 minutes where I think we can answer some of these questions. And my colleagues, feel free to chime in here.
Sorry about that, Johnny. I was on mute.
Oh, great.
Yeah. So, yeah. So as the team reviews the questions that have been posted into the Q&A box, just a couple highlights. I posted into the chat, which is different from the Q&A. A couple of resources. First, on the warning messages, we did try to address, as comprehensively as we could in the Cures Act final rule several years ago, this notion of warnings. And I think, Greg, to your question, you're generally tracking correctly. And, I think we all recognize that this is a tricky environment to operate because we want to make sure that patients have enough information to make informed decisions, but those decisions are for them to be making. So at any rate, we also posted a link to the Health IT feedback and inquiry portal. If you're not familiar with this, please submit information if you think something is awry. I know that there are a few questions and a few comments in here related to the behaviors and actions of certified developers as they interact with patient access apps. It's really important that we get as much detailed information as we can. Obviously, I think as Keith highlighted at the beginning, when we started down this journey, the blog that the Assistant Secretary for Technology Policy, Mickey Tribathy, issued a number of days ago. This is all part of I think what we're trying to be is a comprehensive strategy in education and outreach. Johnny mentioned a number of resources that we have in the works, and this is meant to help developers be conformant, really. And so at any rate, please, do use the feedback portal for specific instances or specific scenarios that you want to bring our attention to. As much information as can be supplied is always helpful. More information is always helpful than less information. Okay.
And we got a lot of questions. So I think we're going to take these questions and can include some responses in the slide deck that we provide. Also suggest for folks who have submitted these questions and didn't get their questions answered, suggest also submitting these questions in the Health IT feedback and inquiry portal. I provided a link in the chat here. Some of these are speaking to kind of exactly what we're trying to educate around today. And some of these practices that we would want to clarify with our educational documents. And I mean, potentially future regs. With 2 minutes, is there any questions that our team wants to try and tackle specifically?
I would just, there's a couple here, just in terms of the timing of the upcoming educational resources. We are looking to get at least a couple of the topics or a couple of the resources out before the end of the year. But I also anticipate that we will continue into the new year with additional resources and additional emphasis. I mean, again, we know that this is and are planning to raise the visibility and profile of these requirements and take action as is necessary to ensure that developers are meeting the letter and the spirit of the law. So seeing that we are at the hour and seeing that also many of these questions are multi-part and actually will require some teasing apart from our team and more careful consideration, I will just underscore what Johnny said. Please use the Health IT feedback and inquiry portal for the questions that we have already received via the Q&A. We will, as was mentioned, we'll try and tackle those, and we'll try and include kind of a summary and answers to those questions as much as we can answer. When we post the slides and the recording And again, we hope to get the recording and the slides posted sometime within the next 7 to 10 days. And with that, I will just say thank you for all of the interactions, all of the engagement, and all of the questions. And thanks to Keith, Scott, and Johnny, and the rest of the Certification and Testing Division here at ASTP. We appreciate the time and attention, and we'll be keep your eyes peeled on the certification program listserv for updates on these and other resources. Thanks, everyone.
All right. Thank you, Jeff, and thank you all for attending today. ASTP will post the slides and recording on the healthit.gov website, like Jeff mentioned, in the next week. Thank you all.